Alright, guys, so today we are going to look at the digestive system anatomy, part 4. This time will be the large intestine. So, the large intestine is approximately 1.5 meters long, and its function is actually to absorb water, salts, electrolytes, minerals, and vitamins actually produced by the intestinal bacteria itself, and it also compact indigestible materials and eliminate your feces as well. Now, for the large intestine, right, it can be characterized by the following, such as the Tenenia cola, the hytrister, and the hepatical epiphagus. So the Tenia cola, it's basically a thickening of the outer longitudinal layer of the muscarius externa. So if you want to learn more about the muscarius externa and outer longitudinal layer, you can go and check part 1 out. I'll talk a lot more about that. So this is the Tenia cola, which is the lines that actually form the anterior, the posterior, and the lateral one. Or you can kind of say transverse as well. And then we have the hydras. So the hydras are basically small pouches in the colon. They give more of a cemented appearance itself. Now, it is actually responsible for cemented appearances, and its form actually due to the contraction of the Tenenia cola, which is the previous slide one, which is this. Okay. And the next one is actually called the apaticular epiphagus itself. So you can see those little small pouches of, so they're actually small outer pouches of fat filled serosa covered with the structures on top of the colon itself. So always remember that the epicolic epiphagus are small pouches of outer pouches of fat filled serosa. So you can see on the layers down here of the large intestine, you can see that will be the Tenenia cola, the yellow ones, and you can see the hydras, which are basically the cemented appearances, and you can see the appendicular epiphagus, which are the fat-filled serosas itself. Now, what is a vesiform appendix? So the appendix, right, arises from the cecum itself. Now, you may think that the appendix may be useless because a lot of times we can get a inflammation of the appendix which leads to appendicitis, but it is not completely useless at all. It's actually because it actually contains lymph node tissues and has a purpose in the immune role as well. Now, in order to actually locate the vesiform appendix itself, what happens is that we need to use a clinical reference called McBurner's point, where we actually find the anterior superior iliac spine of the pelvis. And what happens is that we would draw a line to the umbilical cord and use a marker to kind of mark out where the appendicitis would be around that region itself. So I would use three thumbs. So I'll measure with my first thumb, my second thumb, and my third thumb to kind of get a knowing of where the vesiform appendix would be at. And this would be a really important role because we need to identify the appendix during surgeries to remove the appendix if there's inflammation of the appendicitis itself. Now, the cecum, right, it's basically located in the right lower quadrant of the large intestine itself, and it's actually the start of the large intestine, where bile is actually secreted inside from the small intestine itself. Now, here you have the ascending colon. Now, the ascending colon arises from the cecum and it courses vertically to the liver, and it stops itself at the right colic flexor. And for the transverse colon, it courses from the right colic flexor to the left colic flexor, and you can see that white part there, that is the transverse mesocolon itself. And you have the transverse colon itself, which refers to the midgut and the hinge gut. So talking about the midgut and the hinge gut, I will talk more about that later in a previous video. I think it will be around part 5 or part 6 if I'm not wrong. And then we have the descending colon, which basically courses from the left colic flexor down to the sigmoid colon, and the sigmoid colon, which will be located on the left side of the pelvis and is a intraperitoneal organ. There you can see the sigmoid mesocolon right there. Now, putting the reference, right, the rectum itself, right, it's either a subperitoneal or a infraperitoneal organ, and only its upper third may be actually covered by peritoneum itself, while the majority of the rest of the rectum may lie posteriorly to the parietal peritoneum itself. So, in my previous video, or like maybe my first part video, I mentioned about the external and internal anal sphincter. So if you guys remember about these muscles, right? Like I said, the external anal septum, it is a skeletal muscle, meaning you can control it with voluntary movement. And for the internal anal sphincter, it is made up of smooth muscle, meaning you cannot control this movement at all. So for example, if there's a buildup of feces in the rectum, right? This actually causes the rectum to actually expand, holding the feces. And what happens is that this actually activates the stretch receptors. And when these stretch receptors are actually activated, they actually relax. They relax the internal anal sphincter itself. So they relax the internal anal sphincter muscles. And this can be quite bad is because when the muscle relaxes, this can actually cause the urge for you to defecate on the spot, if not unable to reach the toilet in time. And for the external anal symptom, right? It is the muscle that you can control, so involuntary movement. So voluntary movement, sorry. So it actually gives you the control to hold that feces before you defecate. So it's kind of like a lose-lose situation where you're basically needing to defecate because the buildup of feces in the rectum causing the stretch receptors to expand, and then this causes the muscles of the internal anal sphincter to relax, causing you have the urge to defecate, and then that can be quite bad as well. So essentially saying that you have poo in your pants. And that's all about the large intestine. So I hope you guys have enjoyed this video. Please go ahead and check out part 1, part 2, part 3, and I hope you have a wonderful day. I hope you have learned a lot from this video, and thank you, and I'll see you again. Peace.